192.7 million Americans landed in the largest healthcare breach on record. Now, two pension funds say UnitedHealth's own board watched that risk build for years and let it stand. A Rhode Island retirement fund, a Swedish asset manager, suing the company's own directors. This is the paper trail they say proves it. Here is the actual document, filed August 7th, 2026, in federal court in Minnesota. Not an SEC cyber disclosure. A shareholder lawsuit, amended, expanded, aimed at UnitedHealth's own board and executives. No item 1.05 appears anywhere in this filing. This is not a breach notice. It is a lawsuit accusing the people in charge of allowing one. So why did automated Filings-radar first call this company simply, quote, investor? Think of keyword software like a metal detector at an airport. It beeps at belt buckles the same way it beeps at weapons. A headline read, Investor suit says UnitedHealth ignored governance, cybersecurity gaps. The software grabbed the first noun. It missed the company entirely. The real plaintiffs are named in the complaint. Rhode Island State Employees Retirement System, a Swedish asset manager representing pension funds, not suing on their own behalf, suing derivatively on behalf of UnitedHealth itself against the company's own directors and former officers. Two institutional investors doing what regulators, they argue, moved too slowly to do. Understand what UnitedHealth actually is. The largest health insurer in the United States, headquartered outside Minneapolis. Under its Optum division sits Change Healthcare, a clearinghouse that quietly processes roughly 1 in 3 patient records nationwide. Insurance claims, prescriptions, eligibility checks, invisible plumbing, until it breaks. In 2022, UnitedHealth closed a deal to buy Change Healthcare, a purchase the complaint values at $13 billion. The Justice Department had already sued to block it, warning the combination would hand one company too much control over competitors' data. A federal court let the deal proceed in September 2022. The government's appeal was still pending when integration began. Here's the first turn. The radar behind this story said regulator enforcement. What actually sits on the docket is shareholders suing their own board. Not a fine from Washington. An accusation from the people who own the company. That leadership accepted risk it should never have accepted. A former Change Healthcare risk director told the court why the timeline mattered. While the Justice Department's appeal was still alive, UnitedHealth wanted the two companies combined so completely that unwinding the deal would become, in her words, nearly impossible. Her verdict on what that speed cost, quote, when you rush, you miss things. The same witness pointed to something easy to overlook. Change Healthcare's catastrophic cyber insurance coverage lapsed after the acquisition. UnitedHealth is a giant, big enough to self-insure. But a loss sized for a giant is not the same as a loss sized for one clearinghouse holding a third of the country's medical claims. A second former insider had a different vantage point. For roughly 12 years, he ran identity and access management at Change, the systems deciding who is allowed to log in and how. His team, about 30 people, built tools UnitedHealth's own side reportedly lacked. Then UnitedHealth's integration plan changed what his team was allowed to run. Change had been what insiders call a CrowdStrike shop. Endpoint security this witness trusted. UnitedHealth required it removed, replaced with Microsoft Defender, a tool he considered weaker. Change also had tools to catch rogue and orphaned accounts. His account, UnitedHealth's side, did not. These are the witnesses' opinions, laid out in a court filing, not a proven cause of the attack. Strip it down to the mechanism both witnesses describe. An antitrust appeal still pending. A merger rush toward completion anyway. Multi-factor authentication skipped on remote access logins to save time. Then, on February 21st, 2024, ransomware landed inside Change Healthcare's network. Second turn. Witnesses call these decisions risk exceptions. Paperwork that let known gaps stand so thousands of offshore contractors would not face login friction. The complaint says those exceptions went up the chain, and UnitedHealth's answer, in the plaintiff's telling, was simple: accept the risk. The specific gap, according to the complaint, older McKesson-era systems, running outdated servers, with offshore contractors logging in through Citrix, without multi-factor authentication. Management reportedly would not fund fixes because those systems were scheduled to move to the cloud. One witness's blunt summary, quote, "A perfect recipe for a disaster." He believes that is where the breach began. Here is what the public record confirms. Compromised login credentials got attackers inside. Reporting says they sat undetected for at least 9 days before deploying ransomware. UnitedHealth disclosed the attack on February 22, 2024, 1 day after detection. The company later linked the intrusion to the ransomware operation known as Black Hat. CEO Andrew Whitty later told Congress he personally authorized paying the ransom. The figure reported $22 million. Paid to keep stolen patient data from spreading further, not to undo the operational freeze already crushing pharmacies and hospitals nationwide. Federal health regulators later confirmed the final scope: 192.7 million people impacted, the largest healthcare breach ever recorded in America. UnitedHealth's own filings put direct response costs near $2.2 billion, plus roughly $867 million in lost revenue at the Optum unit that owns Change. A hospital survey from that spring put numbers on the human cost. More than 9 in 10 hospitals said the attack hurt them financially. More than 7 in 10 said patient care itself suffered. About 6 in 10 reported losing over $1 million a day. Behind every one of those percentages sits a pharmacy counter, a claim, a patient waiting to know if their coverage still works. Third turn. While Change Healthcare burned through billions in breach costs, UnitedHealth kept buying back its own stock, more than $29 billion worth since 2021. The complaint calls that a governance failure on a historic scale. That claim is still just an allegation. The dollar figures around it are not. The amended complaint stacks more onto this file. Allegations only, not court findings. An internal audit allegedly found around $200 million in unsupportable Medicare billing codes, and leadership allegedly chose to eliminate the audit program instead of the codes. Executives allegedly sold more than $237 million in stock during the years in question. None of this is proven. All of it is now in front of a judge. Congress had already heard enough by May 2024. CEO Whitty testified in person. Senator Ron Wyden told him the breach could have been stopped with what he called Cybersecurity 101, plain language shorthand for multi-factor authentication most companies already treat as routine. Open questions remain on the docket. Will the 2 confidential witnesses ever testify in public or stay sealed? Will federal health regulators close their investigation with fines beyond the billions UnitedHealth already booked? And will a judge ever rule on whether accepting those risk exceptions was negligence, or simply business as usual at a company this size? The corporate lesson is not subtle. An antitrust clock is not a reason to skip multi-factor authentication on remote access. A risk exception is not the same as a fixed risk. And self-insuring against a loss this size only works until the loss actually happens. For patients, the takeaway is simpler. If your provider or pharmacy touches Change Healthcare, your data may already be in that 192 million person pool. Watch for breach notices. Freeze your credit if health data was involved. A calm quarterly filing does not mean the clearinghouse behind your care was never touched. This started as a Filings-radar mistake, a headline token called, quote, investor. It ended somewhere heavier. 2 pension funds asking a federal judge to force the cybersecurity controls that, by their account, a rushed merger and an accepted risk exception never delivered. These figures come from federal court filings, SEC disclosures, and health industry reporting. Full links in the description. Corporate breach. Which corporate filing should we open next? Case closed until the next filing.